Taking aspirin during your pregnancy may be key in preventing some women from suffering another miscarriage. Now, wait a second, ladies. As I've always said on this channel, do not just listen to me and go ahead and practice some of the things that I'm saying, because clinical situations will vary for each and every single one of us. So do make sure that the recommendations I'm making on this video are always discussed with your own doctor as to whether or not it's applicable for you. Now, back to the reasons why aspirin may be beneficial for some women during their pregnancy. Taking aspirin may prevent preeclampsia, especially for women who have had high blood pressure in previous pregnancies or have high blood pressure before falling pregnant. Aspirin should always be given in women who have a history of antiphospholipid syndrome. And in this condition, the antiphospholipid antibodies can increase the risk of blood clotting. And so aspirin may help to reduce this risk. Other clotting disorders, such as thrombophilia, aspirin is great at preventing clots in women with a background of clotting disorders. Also, aspirin is beneficial to prevent intrauterine growth restriction. In these cases, aspirin improves the blood flow to the uterus and reduces the risk of intrauterine growth restriction, which is where the baby doesn't grow to the expected date. And finally, aspirin is also beneficial in women with multiple pregnancies. For example, women who are carrying twins or triplets, who are at a higher risk of preeclampsia and other complications. As soon as you find out that you are pregnant, you must take folic acid. If you have no other condition, you're fit and well, you must take 400 micrograms of folic acid, which will usually be 1 tablet daily for the first 12 weeks. However, if you are a diabetic or you have suffered multiple gestational diabetes, that is diabetes during pregnancy, your dose may be higher. You may be recommended by your doctor to take folic acid 5 milligram daily for the first 12 weeks or possibly longer. Again, check with your own doctor. And finally, something that you may want to discuss with your doctor is if you may be suitable for a progesterone pessary. Taking progesterone early in the pregnancy within the first 16 weeks is recommended for women with a high risk of early miscarriage who are having vaginal spotting or bleeding. So please don't rush to your doctor demanding for a progesterone pessary. The clinical situations, as I've always said, vary. That's it for this video. I truly hope it's been helpful and provided a source of hope for women who have experienced a miscarriage or multiple miscarriages. I look forward to seeing you in our next video. And if you have suffered a miscarriage or multiple miscarriages, please share your experience, what you may have done, what you feel I may have left out in this video to encourage another woman. Let's support one another in this HeyDoc community. Take care, and I look forward to seeing you in our next video.